Well, this is National Small Business Week, so today we start our two-part series on issues affecting small business owners and their employees. And one of the biggest challenges for these entrepreneurs is rising health care costs. The Wall Street Journal's Lynette Calfani has more.
My name is Stu Nixon. I'm the owner of Montville Hardware and Supply. We've been in business for 7 years.
7 years of hard work, and it's getting even harder. For small business owners like Stu Nixon, providing health care insurance for his employees is jeopardizing the health of his business.
We've gone through, consecutive increases. This year was 15%. The last contract was 10%. So in the last 2 years, I've already gone up 25% in health insurance costs.
For Nixon, that means he can only afford to offer health insurance for 2 of his 6 employees. The others will face big bills if they get sick or hurt, and Nixon faces losing good employees if they get a job offer with health benefits. It's a big problem for small businesses.
I think it's very critical for small businesses. The fact is that if you want to retain good workers, I think it's imperative that you have some sort of health care.
Rising health care costs are affecting businesses nationwide. In 2001, the cost of health care benefits for the average U.S. worker totaled $5,162. That represents a 12% increase over the prior year. And experts predict health care costs will go up nearly 13% in 2002.
The SBA defines a small business as one with less than 500 employees. By that measure, roughly 99% of the nation's 25 million companies are in fact small businesses. So chances are, if you don't personally work for one, you know someone who does.
Paul Cashnelli of New Jersey's Small Business Development Center says there's another reason for concern.
I think it's an excellent point to be stressed that why should I be concerned about rising health costs? Because you will either pay it directly in co-payments or indirectly for higher cost of products.
Destiny Health may help you.
So what can be done about rising health care costs? Ken Lindy, the CEO of Chicago's Destiny Health, says he has a solution.
Destiny Health is a health insurance company that separates controllable from uncontrollable health care costs. And for uncontrollable costs, we provide very comprehensive first dollar or low deductible coverage, not a high deductible plan. And for day-to-day expenses, we create what we call a personal medical fund. That's a use it or keep it fund that always stays the consumer's money.
With traditional health care providers, if you pay your premiums yet don't use your plan, you don't get anything back. But with Destiny Health's plan, you do, either money or rewards, like frequent flyer miles or discounts on health club memberships. And because Destiny Healthcare emphasizes flexible co-insurance levels, co-payments, and benefits that the employer and employee choose, users can better control their health care costs. There are other solutions, too, such as securing group insurance rates through trade associations.
And if they don't provide it, maybe they should lobby their association to make an effort to try and secure some form of health insurance.
Now, while health care costs rose an average of 12% or so last year, in some industry, the increases were much huger than that, anywhere from 20 to 60%. And small businesses definitely feel those increases more than their larger companies do. Here's why. A small business owner paying an employee minimum wage spends about 48% of his labor costs on health care, but a big firm paying an executive roughly $42,000 a year pays only 14% of labor costs on health care. Clearly, there's a lot to be done here to help the small business community get over this very real hurdle. Sue, back to you.
Thank you very much, Lynette. And tomorrow our series continues. We will take a look at what's big in small business. Jane Wells tells us, what is the fastest growing area in small business? It is an area with big opportunities.
Coming next.